everybody. I want to welcome you to Rhythm Flow Radio, right here in the house at Earl built, the number one internet radio station, IntellectualRadio.com, an iHeart radio station. And we are doing a special segment today on COVID 19. I'd like to welcome our in studio guest, a PhD in nursing. We know her as Dr. Mary Maryland. She is going to give us some information that we can live with. She's going to tell us how we can live with ourselves with this pandemic. She's going to give us some information to show us how not to be stressed out in this situation, how we cannot run over each other in this time when we're all stressed out. Some of us are like me. I'm running around with my head in my hands, even though you see it sitting on my shoulders. It's really not there. So, at this time, I'm going to get off this mic and I'm going to give her the privilege of talking to everybody because it's definitely not about me. It's about COVID 19. Dr. Mary Maryland, take it away.
Good morning, Katie, and thank you so much. I appreciate the opportunity. What's important, I think, for everybody to remember is that we are not helpless in this situation. There are definitely some things we can do for prevention to help keep ourselves, our family, and our loved ones, and general public well, and help prevent the spread of COVID-19. First, identify it as a virus, not unlike the common cold, meaning there is no antibiotic you can take to make it go away. So the goal is to contain the spread, which is why you see such significant public health measures being put in place. And it's important to remember that what we are going through in terms of social distancing, in terms of not being out in the public, in terms of sheltering in place, those are all public health measures to prevent the spread of this virus, of this illness. Some things we can do in our homes. If you have a cough, a cold, a sneeze, use a tissue. Previously, we've said sneeze into your elbows, those kinds of things. Right now, the best we can do is if you have a sneeze or a cough, use a tissue, get rid of it, put it in the trash. Sometimes we lay things on surfaces. Another thing to remember is that this virus can live on surfaces hours up to days. So it's not a matter of air out the house and in 20 minutes it's gone. It can live on surfaces hours up to several days. So hand washing is particularly critical. And I know we're accustomed to using hand sanitizer, and not that hand sanitizer is not a good substitute when soap and water is not available. But the gold standard is soap and water. So you need running water, soap, friction, and a hand washing that lasts at least 20 seconds. So soap and water is the gold standard. Running water, soap, friction, and wash for at least 20 seconds. So that quick little flip in the water we're used to doing, that won't help us now. So it needs to be a thorough hand washing. And then afterwards, remember to dry your hands. As you touch wet surfaces, everything on that surface is now on your hand. So good hand hygiene is what we call that. The other piece is to think about this in terms of a respiratory illness. If you think about when you use, let's say, a cooking spray, when you spray that in a cooking utensil, like there's a mist that spreads around. So think of the same thing as if you're having a cough. And so you are putting those droplets into the air. So protection from those droplets is particularly important. And so you want to contain them, ideally with a tissue that you immediately put in the trash. The other thing is to protect yourself from people who are sick. So everyone has the risk of getting this virus. Some people think it's only a virus that affects older people. So let me put that to rest. Everyone is at risk of getting this virus. Now, if you have pre-existing conditions that already compromise your health status, such as you have lung problems from smoking, emphysema, chronic obstructive pulmonary disease, compromised immune system, you are more at risk. But over time, we have come to see that even younger people are at risk. Children are not immune. Children are not immune, and they can pass the virus to others. So we literally are all in this together. So prevention in terms of keeping yourself well, it's important that you are appropriately hydrated. It's important that you get enough rest. It's important that you have good nutrition. So, all the things that should be our regular public health, wellness, take care of ourselves practices now just get more emphasis. So, in your household, if you have someone who's potentially compromised, many of us have aging parents, many of us are aging ourselves, and often there are multiple generations in a household. So, figuring out how to best limit exposure. So, if there's someone in the house that's ill, if they could have their room to themselves where they are not in contact with everybody else in the household, if possible, if they could have a separate bathroom where everybody else is not coming in contact to them with their when they're sick. The other piece is being sure that people are well supported. We are calling our distancing, and you can see it here in the studio. We're doing our social distancing. It's not meant to be social isolation. When people are not well, they need to know that other people are caring and concerned, that other folks are checking on them. Be sure you know how your neighbors are. Don't let this be the time when your neighbors become strangers. This is the time when we literally are all in this together. As we know out in the world, some stores have limited supplies of things. If you're one of those people who has a little bit extra, share it. This is the time when we should be that village for each other. So we're going to do our part in terms of keeping appropriate distance from each other. We are going to limit our social interactions. Right now, the best advice we have is to limit social gatherings to no more than 10 people. I'm going to say if you're at risk, you want to limit it even more severely to minimize the risk that you get this illness. Let's talk about what this illness looks like and when you should really be concerned. First, let me tell you, the emergency department is not where you want to be if you are not acutely ill. Acutely ill, having a hard time breathing, having chest pain that does not let up, if indeed you are having significant fevers. And the best way to check about a fever is with a thermometer. So anything over 100.4, you're not recovering, you're not getting better in a couple of days, that's the time to get a hold of your healthcare provider and ask for advice. A typical usual cold, self-care, hydration, rest, the things that control fevers will get you better. So don't panic. Don't treat normal illness any different because you are afraid it might be the virus. You don't want to expose yourself to an emergency department. You don't want to be in an emergency department when people who have emergencies need to be taken care of. So this is the time to think as a village community. What is it that you really need, and how can you have self-care to get yourself through what might not be anything more than your typical usual cold? That's not to say do not use an emergency room or 911 if you are acutely ill. By all means, do that. But don't get overly stressed or panic stricken because you suddenly have a sniffle or a cough. So I think the other part to talk about right now is what are the symptoms that you should be paying attention to? Certainly a fever, a cough that does not abate, a cough that leaves your chest in pain or hurting, difficulty moving air, difficulty being able to take a deep breath. These things can come on suddenly and acutely, and they can be an emergency, but be aware of how you normally respond to a cold. So if it's your body aches, I don't feel good, I've had this before, Give it a day or so, don't worry. But if it is acute, indeed you are feeling like this is something I'm not familiar with, I've never had this before, that's the time to indeed get a hold of your provider and perhaps even enter the emergency department system. But recognize once you go to the emergency department, you are also putting yourself and your families at risk, particularly if you do not want to be there. Again, prevention, hand washing is the best tool we have. Let me take a moment to talk about hand sanitizer. Hand sanitizer is a good backup if you do not have the gold standard of soap and water. Good backup. Be sure that it is at least 60% alcohol. You need enough of it in your hand, not half a bottle. Quarter size is probably enough. And you need to rub your hands together for the entire time that that moisture is present. So you need to rub your hands together until they are no longer wet. The alcohol based sanitizer needs to stay in contact with your skin for a specific amount of time for it to be effective in killing bacteria. So just squirt, rub, and go. Nope. Got to use it until it's dried on your hands. That way you've gotten the protection that the hand sanitizer can offer. Let me take a moment to talk about what we're seeing out in the environment. We see people in masks, and it may be appropriate for some people. We see people with N95 respirators. That's that special equipment that is particularly used by healthcare workers. We see people being overly cautious. Of course, if you are sick and you need to go out, you have a cold, you should be in the mask. If you are at general risk, you are regularly healthy, you don't have a compromised immune system, then there isn't a reason for you to be out in a mask with gloves on. And I know we've all seen it. So general risk, general usual precautions. So don't panic. We've got this. We'll be okay. We'll be okay on the other side of this. What it is that this is all new. I don't remember when schools were closed, when restaurants were closed. So this, for the moment, is our new normal. But we are capable of adapting and adjusting. So you have to figure out how to be creative with having everybody in the house together. For some folks, that creativity is going to be a little more challenging than others. So recognize that this is, though we don't know the length of this, it is likely not permanent, but it is important in terms of the public health of everybody that we do as much as we can to contain this virus. And that's what this is about. So get on board, do your part, help your neighbors, hand washing, folks that are ill. If someone comes to your house and they have a cough or you're concerned, let it be socially acceptable to ask them to wash their hands. Let it be socially acceptable for you to ask them to go home. Let it be socially acceptable for us to keep each other protected in the best ways that we can. That's how we will get to the other side of this. Well,
Question.
yes, ma'am.
The internet, everybody runs to the internet for information. And one of the great myths that's out there is that African American skin resists COVID-19. Let's put that to rest today.
Oh, absolutely. It has nothing to do with anyone's skin tone. It is a virus. And the biggest risk is breathing those droplets from people who have been exposed or positive. So, nope, this is not one of those things that provides some protection simply because you happen to be African American or any other race or ethnicity or nationality. It is a respiratory borne illness, and it is to be taken seriously.
Okay, man, I want to ask you one thing about this virus. You say it is a virus like any other virus.
It is a virus not unlike the common cold that is also a virus. This virus has specific traits to it. You may have heard in the news that the people who look at genetic compositions of viruses are close to identifying what may be the particular parts of this virus, and that will help them come up with a potential vaccine. So the science community is getting involved in this and working collaboratively to give us an answer. So it's a virus. There are not antibiotics that work against viruses. It's a matter of limiting exposure, self-care, palliative treatment. If you are not acutely ill and you get your normal fever, you treat it as you would any other cold that you would get. Limit the exposure to secretions. Be sure you're well hydrated. And let me say a word about hydration. Dry mucous membranes can be skin that is cracked, and that allows an entry point for viruses. So you want to be clear.
Repeat that now.
So dry mucous membranes, we're talking about our mouth, our nose, our eyes. So sometimes people fail to realize that excessively dry mucous membranes can cause broken skin. Broken skin becomes what we call a portal of entry. So that's where you can unnecessarily expose yourself to viruses. So being sure that you're well hydrated. People laugh when remembering at some point in the not too distant past, we would use Vaseline in our noses or put Vaseline on our mouths. So the goal is to create a protective barrier to limit the opportunity for viruses to enter our systems. And so, no, I don't want to see kids walking around with a layer of Vaseline all over their bodies. But the goal is to stop cracks and mucous membranes that could leave us vulnerable. So hydration is critically important.
Okay. Listen, let's take a break for a minute. Then we're going to come back and let her explain another segment of COVID-19 that is affecting us all. Because listen, we go in the grocery stores, there's no toilet paper, there's no paper towels. Some places, there's no food. Hey, there's no water. So we're going to come back and talk about how to deal with that issue. We'll be back in a moment. I want to welcome you back to Rhythm Flow Radio, right here in the house that Earl built, the number one internet radio station, IntellectualRadio.com. This is a special segment on COVID 19 with our in studio guest, a PhD in nursing, Dr. Mary Maryland. Thank you. I appreciate you taking your time out to come in this morning to spread the message and give us some enlightenment to help us calm down. Because I tell you, literally, my head is in my hands.
Thanks so much, Katie. It is a stressful time. We're in uncharted water. We're unfamiliar with it. We're not sure exactly about what to do. Before we went to break, you were talking about not being able to find needed supplies in the stores, even groceries. So one of the things that we can all do about that is buy what we need. You don't have to plan to not be able to go to the store for the next 6 months. So the double carts full of things because it was available and you got there first. Again, we're a community, we're a village, and if we each get what we need, then we each have the best opportunity to survive this well. So, indeed, there's no need to do panic buying. There are times when our governmental agencies, the CDC, the Public Health Department, indeed give us good information. There is no shortage of food. Uh, there is no lack of access to food. Stores will be replenished. And so if we all participate and be literally our brother's keeper in terms of getting what we need, but not trying to stockpile those supplies such as toilet paper, paper towels, sanitizers, bleach, even food. Entire sections of stores have empty shelves. There was no sudden increase in the number of people on the planet, but you would think that suddenly we had twice the number of people because people are panic buying. Calm down. It'll be okay. People won't starve. And again, if you can share with a neighbor, do that. Sometimes that simple gesture can allow somebody else to take a breath, regroup, and be able to solve this all together. We are all in this together, and there is no shortage of food in the United States. There is no shortage of paper towels, a shortage of toilet paper, but we create those artificially when we buy more than what we need. So take a breath, calm down, it'll be okay. Some stores are actually creating specific opportunities for older people to come shop. If that works for you, that's fine. Remember that older people can be more susceptible, so putting all the older people together may not be the best public health strategy, but you do want to think about seniors who may not be able to navigate as well among all the folks who are out there trying to stock up on supplies. So if that particular set aside of hours is working in your community, by all means, take advantage of it.
You know, I want to say, I think that that's a great idea. I am a senior citizen, but I can't understand why would they want me to be in the store at 6 o'clock in the morning? Why should I mean, I think it's I think it's a great idea that they set aside a time for the seniors to shop. That time is from 6 to 8 a.m. in most stores. Why would you want a senior to get up at 6 a.m. in the morning? That means I've got to get up at 5 to get dressed and take a shower. And I got to be at the store by 6 when that door opens. And I've got 2 hours to shop. I think that is I don't think somebody wasn't using their head.
I think what's important is to remember that people are having good intentions. So perhaps they didn't think through, is a senior up and functional at 6 a.m.? I believe the intent was good in providing a set aside time for more vulnerable seniors to be able to get into the store and out with all of the ruckus. I think it's also important to recognize that we're also having the social distancing.
Absolutely.
So businesses are limiting the number of people that come in. People in aisles to pay for food should be keeping a distance from each other as they go to check out. So I think as we make the adjustments for our new normal, we have to go along with the program and realize that people have good intentions, and that's okay.
Can we set a time limit on COVID-19?
We absolutely cannot.
Okay.
No crystal balls.
Okay.
What we do know, what science has taught us, is that the incubation period can be from about 2 days to about 14 days. So that's why you're hearing the standard being shelter in place for 2 weeks. If indeed it turns out that we need to do it longer because what we know about the virus through science gives us new information, expect to get changes. So we absolutely do not know how long this will last.
So I shelter myself in place for 2 weeks. And after those 2 weeks, I come out. Now, I am a high risk. I have an autoimmune disorder. Number one, that makes me high risk. Number two, I'm a senior. I'm 69 years old. That makes me high risk. So I've sheltered myself I've incubated myself, as you said, quarantined myself for 2 weeks. Now I come out and I decide now I'm going to go out and do some things, But what if I'm out and I come in contact with somebody who has the virus and don't know that they have the virus? I'm in trouble.
That's true for all of us, which is why you have the public health guidance of all of us shelter in place. This has already been identified as a pandemic.
Okay.
So it's not an individual, it is all of us collectively. That is why we collectively have been told shelter in place, no unnecessary being outdoors, no being in crowded places, despite the fact that you see the young ones on the beach when they shouldn't be. So this is a keep us all safe. So yes, you did your 2 weeks, and now you have to decide after that 2 weeks, and within the guidance of our public health officials, how much can you now go about your regular life? And it may be that your life is still somewhat restricted. And we always want to err on the side of safety. And so your best judgment, we can't look at a person and tell their individual risk factors. You know your health history. Mm-hmm. So what is it that you personally need to do to keep yourself safe and continue to let that be your best guide?
Okay. Do you think that after this is over, I'm just looking at the big picture. After this pandemic is under control or after it's over, will it be business as usual?
No crystal ball. The likely answer is no. So let me give you an example. One of the things we've done, and I work as a nurse practitioner, we have moved some office visits to phone visits. Will we see more use of that? Perhaps. The government has seen fit, the Centers for Medicare and Medicaid will now reimburse for telephone visits.
What?
So I can have a conversation with a patient. I can find out if they are unrelated to COVID. I can find out if after an ER visit, they still have a fever. Are they breathing better? Are they able to tolerate food? Do they have enough medication? I can have access to their medical record online. So I believe we will see perhaps one of the positives out of this is that we use technology even better.
So how would they take my vital signs?
Good question. So let's say hypothetical patient. You have hypertension. You maybe take a blood pressure medicine, you take a water pill, and you are now going to have a visit over the phone. One of the things that we should be better at, and hopefully will be an outcome of this situation, is that you should have already had a functioning blood pressure cuff at home. So when you get the phone call in advance of your provider visit on the telephone, someone will ask you, can you check your blood pressure for me and tell me what it is?
Okay.
If you take a water pill, it might be a good idea for you to have a scale. What was your weight this morning? Those are things we can have a conversation about without you being in the office. And the good news is many insurers, many insurance companies will now provide as a benefit of their insurance an allowance for you to get that type of self-monitoring equipment free of charge.
Mhm.
So healthcare should always be a partnership with you and your provider. So your part is to be sure you are doing self-monitoring in between visits. And the provider's part is to ask you about that. Similarly, if you think about a diabetic, they can check their blood sugars at home. You'd be surprised at the number of people who don't do that. And so when you get the phone call that your phone visit is about to happen with your provider, get your meter, look at the numbers, what have your sugars been running, and we can give you guidance based on information that you give us. So this may force us to develop a bigger partnership in keeping you healthy.
All because the pandemic has changed things, how uh, doctors see patients.
All because this is how it should have been all along.
Really?
So individuals should know what their blood pressures are. Individuals should know what their weight is. If they have, if they're using a diuretic, if they have congestive heart failure, if they have chronic diseases. So these are, we used to call it numbers you should know. Height, weight, blood pressure, those types of things should be regular things that you know on your own, not things that you go to your provider to find out.
So a person online wants to know. So does she think that the bars and restaurants will open up soon? This is somebody that's watching online, and this is one of the questions that they wanted to know. They want to know will they open up soon.
So again, no crystal ball.
Okay.
All of this depends on how good we are at what you've heard in the media at flattening the curve. Will the number of cases continue to spike, meaning go up, or will we see them start to level off? In the immediate short distance, we're likely still to see an increase because testing is happening more. How soon we'll start to flatten the curve? Unpredictable. But we do know from a public health point of view, we flatten the curve as we each do our part to limit the spread. We flatten the curve as we each do our part to be that village and take care of each other.
Well, you know, this pandemic, it has a trickle down effect, because when it hurts one, it hurts all. It can hurt me, but it also can hurt others in my family. Because whereas maybe, as say that I had a job whereas I could help 2 or 3 people in my family, if I'm working in a field, whereas that job has been cut, I've been sent home because it's a non-essential job. You know, I have no salary now. I have maybe they're going to pay me for 2 or 3 weeks. But after that, I have no income. So now I'm not able to help other people. So this pandemic has a trickle down effect on everybody.
You're exactly right, Katie. And we don't know yet the full extent of what this will look like across this country. There are some businesses that won't survive this. There are likely going to be changes in how we work and live in the world. We are finding that indeed some services can be managed offsite quite nicely. So will we go back to having the same amount of people in office that we had prior to this? Only time will tell. But indeed, we are learning that we can effectively live our lives in a changed environment. Now, families certainly will have some struggles. I had the opportunity to work at a food pantry as a volunteer, and we have changed how we do that. Rather than having people inside in close quarters where they can't have social distancing, we're still able to give them their fresh fruits and vegetables, their meat, their bread. We included toilet paper, the usual cooking oil.
Oh,
We had them come up to the building, and we were giving them things through the window. So they still had access. Food is a necessity, an essential service, but we changed how the distribution occurred. So, what modifications will we see generally in our lives as a result of COVID-19? Yet to be determined. One of the things in support of each other that we can do within families and within our global community is to reach out to folks. Don't assume that everybody is okay. This is a time when it's okay to not be okay. If you need some help, you got to ask. Seek out resources from other folks. We are all in this together, quite literally.
you know, we live in a world where we are really so connected. And we're connected because we're all centrally from one being, whether whether we realize it or not. We live in a world that's so full of racism, and this pandemic has brought us to our knees. It has literally brought us to our knees. It doesn't have a face, it doesn't have a race. It will affect anybody. And I think it's about time that we really wake up. It's really a time where people should wake up and take this thing seriously. I can think about when they question that man that's up there in Washington that occupies the White House whenever he does. And he told us that this was no more than like having a common cold, like, having the flu. He said it was, he didn't make a big thing out of it. And right now in New York, I believe there are about 11,000, over 11,000 cases right in New York in New York. And about 8,000 of those are in New York City. So this is a very serious thing. And we don't have any idea once it really hits the United States and I mean other cities and other states, how big this thing is going to be. And I'm going to tell you, I'm scared.
We definitely are in unknown territory. And so our best intervention is to control what we can. And the best things we can do are try to limit the spread. Again, try to flatten that curve. Follow the guidance of the experts. That would be the CDC, Centers for Disease Control. That would be public health departments locally. They have a handle on what's going on in individual communities. And so, yes, on occasion, elected officials provide information that may not be the best or most current. So recognize where you can get reliable, scientific based information. And I think more recently, we have started to see more of that type of information being distributed to the public. So be aware of your information source. The internet may not be the best place. Certainly, people in the scientific community, public health departments, the CDC, folks who do this for a living. Those are the experts that can give you the best guidance. But I think you mentioned something else that's really important, Katie, self-care when you're feeling stressed. So what is it that you do? Where is that place that you go to calm and reassure yourself? So now is a good time to know those places. If it's a phone call with a friend, if it's maybe a certain show that you haven't watched, if it's a movie that you haven't managed to see, online, of course, since those places are also closed. So find the things that can give you solace. Find the things that soothe you and calm you down, and do those things. We don't know how long this is going to last. It's not predictable, but there's some things that we can do to make it more manageable, individually, personally, within our families and within our communities. So take a breath. Don't panic. We will get through this, but we will get through this as a community. This is not an individual problem. This is a pandemic. As you indicated, it impacts us all, and we're in this together to make it better.
Yeah, well, this is I don't know. I guess it has really gotten me, the more I think about it, the scarier I get. Um
So let me offer a solution to that partially.
okay.
Don't spend 24/7 engaged with the news, because the gloom and doom, the world is coming to an end. There's a limit to our adaptive capacity when we are bombarded with repeated negative messages. So turn it off. Take a break from it. Find some music that soothes your soul. Reach out to another person. Go for a walk. We are not quarantined. We're not under martial law. Do something that gives you momentary relief from the enormous stress of this situation. Um, as we get respite from stress, we build our immunity back up. We build our resource stores. We recharge. Kind of like after you've had a really good night's sleep and you get up, okay, I'm good to go. So maybe it is getting a little more sleep, going for a walk, getting some exercise. The things that normally improve your ability to cope, you need to rely on those things now.
So basically, there's no over the counter medication that you can buy, right?
There's no magic bullet. There's no magic pill. The way to control this is each one of us doing our part.
Okay.
And something as basic that we all learned as little children: wash your hands. Sneeze into a tissue. Limit your contact with other folks, particularly if you are sick. Shelter in place to limit your contact with folks who are sick and may not know it. So keep yourself hydrated, good nutrition. Our common sense approach to this is good science, good public health, and will help us limit this illness.
Okay. You heard it from PhD in nursing, Dr. Miriam Maryland. Anything else you want to leave us with?
Absolutely. Self-care is critically important, both in terms of coping. Don't let this overwhelm you. Hashtag we got this. We got this. We can get through this. The other thing is the same things that we've always known through public health crises apply now. Hand washing. If someone is sick in the house, isolate them as much as possible without withdrawing caring for them. For example, now might be the time to have a specific set of towels for that person. Now might be the time to use paper towels in care with that person. And let me say a word about gloves and masks and all of those things that some of us are doing. Be careful about how you handle those things when you take them off. There's an appropriate way to do that. So gowns, masks, gloves, we typically call those things personal protective equipment. You may hear it referred to as PPE. If you are using gloves, masks, and gowns, take the gloves off first. Don't use the gloves to untie your mask or untie your gown. Take the gloves off first. Wash your hands, running soap and water, a minimum of 20 seconds. Dry them, then take off your other protective equipment. The science behind that is your hands come in contact with the most things, and then they are the most soiled. And so you want to get rid of the most soiled thing first. Gloves inside out, take them off, wash your hands, soap and water, 20 seconds. Then remove your other personal protective equipment. So don't put those really soiled gloves up to your face to take off your mask. The other thing, be careful about touching your face, period. We all do it unconsciously. We have our hands in our faces, as Katie just laughed. So recognize that hands to face, hands touch a lot of surfaces, and we are now putting whatever has gotten on our hands on our faces. Remember, we talked earlier about mucous membranes, mouth, eyes, nose. So do your very best to keep your hands away from your face. So it's a new consciousness, it's a new way of life. We can do this. We can do this collectively, and we will get to the other side of this, likely with a new normal. And if that helps prevention for the next thing that comes, and there will be a next thing, we're all the better for it. I appreciate the opportunity.
All right. Listen, I thank everybody for tuning in to this special segment. Dr. Mary, I really appreciate you taking your time out. This is Rhythm Flow Radio right here in the house that Earl built, Intellectual Radio, and I had radio station, and we're out. Thank you.
So,